The pressure that's generated by the fluid secreted from the sustentacular cells is what's going to push the sperm and the fluid along the lumen of the seminiferous tubules, and then into a series of short ducts that lead to a network of ducts in the testes called the rete testis. From the rete testis you have these little efferent little efferent ducts that are going to propel all of this sperm and the liquids out into the epididymis. So the epididymis is an organ that's about 1.5 inches long, and it curves along the superior and posterior border of each testis, sort of comma shaped. The epididymis is the site of sperm maturation. So this is a process where sperm become motile and have the ability to fertilize an egg. This process usually takes about 14 days to happen. The epididymis also helps to propel the sperm into the vas deferens or the ductus deferens during sexual arousal because of peristaltic contractions of the smooth muscle, just like we have with the peristalsis of moving food through the digestive tract. But in addition to that, the epididymis also stores sperm, which can remain viable in the epididymis for up to several months. But at a certain point, any stored sperm that are not ejaculated are going to be broken down and resorbed. All right, so let's continue with this duct system. So the tail of the epididymis becomes a little bit more straight and its diameter increases. And beyond that point, the duct is known as the ductus deferens or the vas deferens. Okay, so the vas deferens ascends along the posterior border of the epididymis and through the spermatic cord, and then enters the pelvic cavity, where it's going to loop over the ureter and pass over and down the posterior side of the urinary bladder. So functionally, the ductus deferens is a conveyor belt, so it moves sperm during sexual arousal from the epididymis toward the urethra by, again, peristaltic contractions of the muscular coat. So like the epididymis, the ductus deferens, though, can also store sperm. And just like we saw with the ductus, or with the epididymis, any sperm cells that are not ejaculated after a period of a few months are going to be reabsorbed. So here you can see a little better view of how the vas deferens or ductus deferens is going to come up and over the urinary bladder, and we're going to pick up this duct system right about here. So the spermatic cord is a supporting structure of the male reproductive system that ascends out of the scrotum. I'm sorry, this would be better if I back up. Let's back up to this picture. So here you can actually see the spermatic cord. I got a little bit ahead of myself. So it's just a supporting structure that ascends out of the scrotum, and each one of the spermatic cords contains the ductus deferens, the testicular arteries and veins that drain the testis and carry testosterone into circulation. It contains part of the autonomic nervous system, some lymphatic vessels, and a muscle that you can see here called the cremaster muscle. So the spermatic cord passes through the inguinal canal, which is a passageway in the abdominal wall that connects the testes and the scrotum, of course, with the rest of the body, with the organs in the pelvic cavity. All right, so now we can move to the ejaculatory duct. So here you have that view again of the vas deferens coming over, and you see it on both the left and the right side. And right here at this little structure is where the vas deferens enlarges. So that's where we're picking up now. So the ejaculatory duct, I'm sorry, I just lost my train of thought. All right, sorry about that. I had to reset my brain there after shifting from slide to slide. So the ejaculatory duct is going to be formed where this little enlarged part of the vas deferens is going to merge with these little lumpy bumpy structures. So this enlarged area is called the ampulla, and these are the seminal vesicles. We're going to talk about those in just a few minutes when we start talking about the accessory organs. But you can see how on each side you've got this merger of the ampulla of the vas deferens with the seminal vesicles, and that is going to run through the prostate gland, and where they do, that is what is known as the ejaculatory duct. So the ejaculatory duct is formed by the merger of those two, and they pass through the prostate gland and terminate at the prostatic urethra. Okay, so right here, begins the prostatic urethra. All right. And let's see, what else was I going to tell you about that? I think that's everything, because we're going to move now to the prostate gland. Or nope, we're going to talk more about the urethra. Okay, so in males, the urethra serves two purposes. It's a passageway for semen and for urine. So it's about 8 inches long. It passes through the prostate gland, the muscles of the perineum, and the penis, and is divided into 3 parts. So the prostatic urethra is where it passes through the prostate gland. Makes sense, right? As this duct continues, it passes through the deep muscles of the perineum, where it's known as the membranous urethra. Okay, so here's prostatic urethra, here's membranous urethra, and then it continues to become the spongy urethra as it passes through the penis. The spongy urethra ends at the external urethral orifice, which is the opening to the external environment. All right, so now let's talk just a little bit about the accessory organs that play a role in the male reproductive system. So the ducts of the male reproductive system store and transport sperm cells, but the accessory glands secrete most of the liquid portion of the semen. So the accessory glands include the seminal vesicles, the prostate gland, and the bulbourethral glands. So the seminal vesicles, remember, we saw those just a few minutes ago. I'll back up just to show you. Right here we have the seminal vesicles. Okay, so the seminal vesicles are sort of pouch-like, bumpy little bags that lie posterior to the base of the urinary bladder and anterior to the rectum. So they secrete a very viscous alkaline fluid that contains a lot of fructose. Now remember, fructose is a sugar. It also contains prostaglandins and clotting proteins that are different from those in blood. So I've heard these clotting proteins referred to before as seminogelin. What would it do? Gel the semen, make it very thick. So the alkaline nature of the seminal fluid is going to help to neutralize the acidic environment of the male urethra, because remember, the urethra is also used to transport urine, and also in the female reproductive tract, because the female reproductive tract is very acidic because it's open to the external environment, and of course that would kill sperm cells. The fructose that's a part of the seminal vesicle secretion is going to be used for ATP production by sperm cells. It's going to take a lot of energy to propel those sperm cells through the reproductive tract of the male and the female. The prostaglandins contribute to sperm motility and viability, and also helps to stimulate smooth muscle contractions within the female reproductive tract. The clotting proteins that can be called seminogelin help the semen to coagulate after ejaculation, and of course that's to keep the sperm cells from leaking out of the vagina and give the sperm cells a better chance, of course, of being taken into the cervix, and then of course the uterus and out to the fallopian tubes. So about 60% of an ejaculation consists of fluid from the seminal vesicles. The prostate gland is about the size of a golf ball. It's inferior to the urinary bladder and surrounds the prostatic urethra. It slowly increases in size from birth to puberty, and then it expands rapidly after about age 30. And it stays about stable until the age of 45, but then it's very common for it to continue to grow after the age of 45, and as it does so, of course, it can constrict the urethra and interfere with the flow of urine. So the prostate gland secretes a milky, slightly acidic fluid that contains citric acid that's used by sperm for ATP production in the Krebs cycle. It contains proteolytic enzymes such as prostate-specific antigen, or PSA, that along with some lysozymes serve to break down the clotting proteins from the seminal vesicles, right? Be hard for the sperm cells to swim through jello. So the seminogelin allows the semen to coagulate, to get thick and gooey, so that it stays in the female reproductive tract longer. The PSA and lysozymes from the prostate break that jelly-like substance down again, because of course sperm cells can't swim through jello. The seminal plasmin also has an antibiotic that can destroy bacteria, so seminal plasmin helps to decrease the number of naturally occurring bacteria in the semen and in the female reproductive tract. So the secretions of the prostate gland enter the prostatic urethra through these tiny little prostatic ducts and makes up about 25 to 30% of the total volume of the semen. Another of the accessory glands are called the bulbourethral glands, and the bulbourethral glands, let's see, you can see them right here. Okay, so this is the bulb of the penis, and of course this is the urethra, so bulbourethral should be pretty obvious where that name comes from, right? These are commonly called Cowper's glands, but they're just about the size of peas, and they're located inferior to the prostate on either side of the membranous urethra, deep within the muscles of the perineum. So their ducts open into the spongy urethra. During sexual arousal, the bulbourethral glands are going to secrete an alkaline fluid into the urethra that protects the passing sperm from by neutralizing the acids that may be left in the urethra from urination. They also secrete a mucus that lubricates the distal end of the penis and the lining of the urethra and decreases the number of sperm that are damaged during ejaculation. Some males also release a drop or two of this mucus when they're first sexually aroused and when the penis becomes erect. All right, so what is semen? It's a mixture of sperm cells and seminal fluid. You may be wondering, well, why is there a difference between seminal fluid and semen? After a male has a vasectomy, he will still ejaculate seminal fluid, which comes from all of the accessory glands we just talked about, but there will be no sperm cells in there. So semen contains the seminal fluid and the little swimmers. So think seamen, S-E-A. They're swimmers, right? All right, so let's talk a little bit about that. So the volume of a typical ejaculation is about 2.5 to 5 milliliters, with about 50 to 150 million sperm per milliliter. So you can figure out the numbers on that, right? When the number falls below about 20 million sperm cells per milliliter, the male is probably going to experience some difficulty in fertilizing eggs. So this is one of the first things that is typically checked when a couple is having difficulty getting pregnant. They want to know the sperm count. So a large number of sperm are required for successful fertilization because only a small fraction of those are ever going to reach that secondary oocyte. And without that many sperms, or without a lot of sperm cells in the typical ejaculation, the chances of getting pregnant will decrease greatly. So despite the slight acidity of the prostatic fluid, the semen still is overall more alkaline due to the higher pH and larger volume of the fluid that's coming from the seminal vesicles. The prostatic secretion gives the semen a milky appearance, and the fluids from the seminal vesicles and bulbourethral glands make it sticky. So seminal fluid provides sperm with sort of a transportation device, right? Also some nutrients and protection against the hostile acidic environment of the female's vagina. Once ejaculated, the liquid semen coagulates in about 5 minutes due to the presence of those clotting factors from the seminal vesicles. After about 10 to 20 minutes, the semen reliquefies because of the PSA and the proteolytic enzymes from the prostate gland. Abnormal or delayed liquefaction of the clotted semen can cause complete or partial immobilization of the sperm because they can't swim through that thick gooey stuff, and of course that's going to inhibit their ability to get into the uterus and then to fertilize the egg. So let's talk a little bit about the penis. It contains the urethra and is a passageway for the ejaculation of semen and of course the excretion of urine. It's sort of cylindrical in shape and consists of a body, a glands, penis, and a root. So the body of the penis is composed of 3 columns of erectile tissue. I'm just going to go ahead and switch to the next slide so we can see this as I'm talking about it. So here we've done a cross section through a penis. There you can see in the cadaver, and here you can see in the cartoony drawing. So the body of the penis is composed of 3 cylindrical masses of connective tissue, and each one of them is surrounded by a fibrous, not connective tissue. They're made of 3 columns of erectile tissue, and each one of the columns is surrounded by a covering of connective tissue called the tunica albuginea. You have 2 masses that are your corpora cavernosa, so here you can see corpora cavernosa, and one column of corpus spongiosum. So the corpus spongiosum is going to surround the urethra, and at the distal end of the penis it enlarges to form what we commonly call the head of the penis, but it is known as the glands penis. Your corpora cavernosa are going to be the larger of the columns, and you can see by their appearance that there are lots of empty spaces in there. So those spaces are going to fill with blood. So we call these erectile tissue because they have lots and lots of vascular spaces that can fill with blood when the penis becomes erect. What else did I want to tell you? Oh, the glands penis is covered with what we commonly call the foreskin, but it is called the prepuce, P-R-E-P-U-C-E. The root of the penis is the attached part and extends into the abdominal pelvic cavity and has two, let's go back right here. Okay, so here you can see two legs. So these are the two legs, the crus. Okay, each one is a crus, and these are columns of corpora cavernosa. So where they extend back into the body, they, along with this bulb of the corpus spongiosum, form the root of the penis. So this is corpus spongiosum, this is corpora cavernosa. Together, all of this forms the root of the penis. All right, so let's get back in here and finish this talk. I think that's all we had there. Let's go ahead and talk a little bit about the male sexual response. So when a male is sexually stimulated, parasympathetic nerve fibers of the spinal cord are going to initiate and help to maintain an erection, which is simply the enlargement and stiffening of the penis. So the parasympathetic fibers produce and release nitric oxide. And if you remember back when we talked about the cardiovascular system, we said that nitric oxide was a very powerful vasodilator. So it does the same thing here. It causes the smooth muscle in the walls of the arteries supplying that erectile tissue to relax or to dilate. And this causes a large amount of blood to enter those erectile tissues of the penis. The nitric oxide also causes the smooth muscle within the erectile tissue to relax. So even the spaces within, the empty spaces, the blood sinuses is what they're called, are going to enlarge as well. So this together increases the blood flow. The increased blood flow and the widening of the sinuses results in an erection when that blood has when it is coming into the penis, and then of course those spaces are filling with that blood. So expansion of these sinuses, that's what they're called, the spaces, are going to compress the veins that would normally drain that blood back out of the penis. So that slows the blood flow outward and helps to maintain the erection. Mechanoreceptors provide direct input to the erection integrating centers in the spinal cord. A major stimulus for erection is mechanical stimulation of the penis, but erotic sights, sounds, smells, and thoughts can also stimulate erection. This involves descending inputs from the brain, primarily the hypothalamus and the limbic system, to the spinal cord. But on the other hand, negative stimuli, bad mood, depression, anxiety, worried about work, can also inhibit erection through these descending pathways. So ejaculation is the powerful release of semen from the urethra to the exterior environment. It's a sympathetic reflex. Now remember, parasympathetic is responsible for erection. Sympathetic reflexes coordinated through the lumbar portion of the spinal cord are responsible for ejaculation. So as a part of that reflexive action, the smooth sphincter muscles at the base of the urinary bladder close, and that prevents urine from being expelled during ejaculation. Semen's going to enter, it prevents semen from entering the urinary bladder as well in backflow. But even before ejaculation occurs, peristaltic contractions in the epididymis and the vas deferens, the seminal vesicles, ejaculatory ducts, and the prostate are going to propel semen into the penile portion of the urethra, what we commonly call the spongy urethra. So typically this leads to a little bit of emission or discharge of just a little bit of the semen even prior to the ejaculation. And this is sometimes what is called nocturnal emissions, when this can occur during sleep. But once sexual stimulation of the penis has ended, the arterioles that supply the erectile tissue contract. The smooth muscle within the erectile tissue contracts again, making those little blood sinuses smaller. This relieves the pressure on the veins of the penis and allows the blood to drain back out, and then the penis returns back to its normal flaccid state. All right, so just a little bit before we finish up about a couple of clinical issues you may hear. Premature ejaculation is when ejaculation occurs too early. So, for example, during foreplay or very shortly after penetration. And it's usually caused by anxiety or any other psychological cause, or an unusually sensitive foreskin or glans penis. For most males, pre-ejaculation can be overcome, though, using techniques such as squeezing the penis between the glans penis and the shaft as ejaculation is getting close, or using behavioral therapy, thinking about baseball, thinking about anything other than sex, or medication to help maintain the erection. Circumcision is a surgical procedure where part or the entire prepuce, or what we commonly call the foreskin, is removed. It's usually done just a few days after birth, before the male infant goes home, and it's done for social or cultural, religious, or very rarely medical reasons. Most healthcare professionals say that there's not really any medical justification for circumcision, but others feel that it does have benefits such as a lower risk of urinary tract infection, protection against penile cancer, and possibly even a lower risk for sexually transmitted diseases. And there are studies that have been done in African villages that have found lower rates of HIV infection among the circumcised men in that particular village. All right, so I think we've finished with the male reproductive system. In our next video, we'll begin with the female.